Iyer, and I'm part of the gastroenterology consultants of San Antonio here, specifically in the Stone Oak area. A little about myself. I actually went to med school here in San Antonio. This was a little over 10 years ago, probably. And then after finishing medical school, I went up to Dallas, and I completed all my training up at UT Southwestern in Dallas. After finishing my training, I stayed there for a few years as faculty at the university. And then eventually we ended up moving back here just this summer. And so today I have the pleasure of talking about the science of stress. This is a GI themed talk, so we'll focus on the effects of stress on the GI tract specifically. So I got the idea for this talk actually from a magazine I saw laying around in the office about the effects of grief on gut health. And this was in Time Health. It was an interesting article that highlighted the case of a patient who had recently lost her mother. Apparently her and her mother were very close and served as a support system to one another. After her mother passed, this particular patient started to have issues with keeping her food down. She presented to several urgent care clinics for these symptoms and was eventually just told it was acid reflux. She was started on medications and she did improve a little bit, but she still had trouble kind of getting back to where she was prior to all this. And this got me thinking in general about, patients we see in clinic every day, and we focus a lot on symptoms, but sometimes I don't know that we necessarily kind of get the story behind every person and kind of what may be affecting them. And specifically the root cause of all these problems is highlighted in this article. So spoiler alert about this talk, stress can absolutely affect the GI tract in a variety of ways. And I hope to go through some of them today. So just a brief outline of this talk. I wanted to start with defining stress itself. I don't think we ever really think about the true definition of what it is. Additionally, there are ways that your body responds during times of stress. And I'd like to highlight some of those changes at the beginning here. When we do get to GI specific conditions, I'm hoping it gives you a more complete picture on how these different conditions are affected. Second, I wanted to introduce the concept of brain-gut axis. This is also an important concept to understand in general when discussing these kind of GI related issues. Next, we'll discuss how stress can affect different areas of your GI tract. These include secretion, gut motility, permeability, the gut microbiome, blood flow, as well as sensitivity. I'll get into each of these in a more detail shortly, and we can kind of go have a more in-depth discussion. We can then talk about kind of common GI symptoms and how stress affects some of these common GI symptoms. And these include GERD or acid reflux, dyspepsia, peptic ulcer disease, which is basically just stomach ulcers, irritable bowel syndrome or IBS, as well as inflammatory bowel disease. And last, we'll talk about some of the ways we can potentially help with some of these issues. Okay. Let's kind of start with what is stress. Reading through all these, kind of reading through for this talk, I found this kind of interesting definition from an endocrinologist, and he kind of described it as a physiologic adaptation to real or perceived threats in the environment. So basically what that means is how you react to what you perceive are threats or real threats in the environment. Now, nowadays, we deal probably more with the perceived threats. These are things like job stress, financial stress, etc. Real stress was probably more more common in the past through ancient civilizations whenever they had to deal with, significant weather or potentially even dangerous situations that they may run into that were life and death. Stress-related responses through the body are mediated by different hormones that signal these, that cause different signals throughout these organs, and they can have different responses. Stress in the short term is evolutionary beneficial. It was built to help us deal with some of these stressful situations that we go through. And it's kind of almost putting us in a hyper-aware state to kind of navigate these tough situations. The problem is when the stress becomes more chronic, instead of these short instances where you kind of turn it on and off, it can be chronically activated, and this can affect something that we call homeostasis. And what that is it's basically, you can think about it as kind of your body's baseline, where it likes to be without kind of stresses, or honestly, you can even think about it as your body's kind of happy place. To understand the stress response a little bit deeper, we kind of classify two different types of nervous systems when we think that we think about. The first is something called the parasympathetic nervous system, okay? And the second is called the sympathetic nervous system. You can think about these nervous systems as routines that your body runs through. So if you think about, at home when you have things like smart speakers and you run through routines where they turn on certain lights during certain times of day, they can turn on your coffee machine in the morning. So each of these nervous systems is a set, it has a set number of responses through different organ systems. And that helps you deal with kind of what each system is built for. So to kind of start off with, the parasympathetic system is responsible for our rest and digest response, as we so call it. It usually decreases your heart rate and blood pressure. Overall, it decreases your metabolism. It's also responsible for most of the normal functions of the GI tract. On the other hand, the sympathetic nervous system is the fight or flight response. So it'll increase your heart rate, increase your blood pressure, increase metabolism. And in this type of stress response, you want to divert energy to areas where it's needed. So you end up slowing down the functions of the GI tract, because the thought is in these types of situations, the GI tract function isn't needed as crucially. And so it'll do a variety of different things. It'll inhibit certain types of secretions that the GI tract usually secretes. It'll also inhibit or slow down some of the movement of the GI tract that we usually see. It can even go so far as altering how much blood flow the GI tract gets. And so kind of thinking about those, you can see that if the stress response does become more chronic, you can see how some of these GI tract symptoms can already start to cause problems. I mentioned this in the beginning when introducing the concept of the brain-gut axis. The brain-gut axis is basically a two-way connection between the brain and the GI tract. Both send signals to one another, and they respond accordingly based on the situations at hand. So for instance, the brain will signal the GI tract regarding things like motility, which is basically the movement of the GI tract, secretion, which is basically how the GI tract kind of releases its enzymes and things like that for digestion of food, and something else called intestinal permeability. So this part I think we'll kind of touch on in just a little bit, but basically, sorry about that, lost my train of thought for a second. But basically your GI tract has a very specific lining, and it's a lining that's very well managed and regulated. You can almost think about it as a kind of wall with multiple entry points. And so nothing can cross this wall unless you have kind of the access to these guarded entry points. Most things can't get through very easily, and the body can be very choosy in terms of what it chooses to kind of go back and forth. This is an important function, especially if you consider things like, your gut has trillions of bacteria living in it, and you don't want those bacteria to have open access to kind of move through the system. One of the problems that stress can do is stress can make these gates a little bit easier to penetrate, and it can ultimately cause certain issues like inflammation to occur. This is where that term leaky gut actually came from. And so once you get some of these signals from the GI tract, you can actually signal back to the GI tract can actually signal back to the brain. And there's actually studies that showed that the GI tract can mediate some of the responses like stress and anxiety, and it can even alter mood to a certain degree. So this, I know I kind of flew through that a little bit, but it is a huge topic, huge enough that it actually has its own book. And so this is a book I've been meaning to read, haven't gotten to it yet, but apparently it's very good it's a very good book in terms of explaining this kind of connection between the brain and the GI tract. So we kind of talked about some of these already. So I'll kind of start with the gut motility, and it's the process by which food moves through the system at an appropriate pace. Stress in particular can decrease your gut motility when it activates that sympathetic nervous system, that fight or flight response. And so we'll tie in some of the consequences when we get to some of the individual GI conditions. We talked about some of the secretions, the secretion aspect of it earlier, but basically it's just timing when to release certain digestive enzymes, stomach acids, et cetera. And stress overall decreases the secretions that the GI tract produces. The next part we'll talk about briefly is just mucosal blood flow, which is basically just how much blood flow is actually getting to the GI tract. And kind of like what we talked about, whenever you have stress response, you tend to divert blood flow to things that need it, such as heart, lungs. And so you actually decrease blood flow to the intestines, which can cause some problems, as we'll go into a little bit later. And this is one of the big reasons why, some of these myths about, eating large meals and then exercising, this is partly what we think causes some of those abdominal symptoms. We talked about, so the paracellular permeability, that is the lining that I was talking to you about of the GI tract that's heavily managed and heavily guarded. We'll get into a little bit of that later. The gut microbiota, I won't necessarily get into it now. I have an entire section on it later. And lastly, visceral sensitivity, it's basically just increased feeling or sensation of what's happening within the GI tract itself. When you have a stress response, it increases your visceral sensitivity. And the way I think about it is stress kind of makes you hyper aware of your own body as well as your surroundings. And so any even normal kind of GI tract functions, such as contraction of the intestines and things like that, you're more prone to sense that and be aware of that. And sometimes this sensitivity can actually feel more like pain than it does kind of just the kind of system working. Next, I wanted to start talking about some of the actual GI conditions and how stress can affect them. So first, we'll start with acid reflux. This is probably one of the most common GI conditions. Everyone knows about it. But I wanted to take just a second to kind of explain exactly what it is, just so we're all on the same page. So The GI tract itself starts at the mouth, and then whenever you take a bite of food and swallow, it goes down the esophagus, which is really the only part of the GI tract that goes through the chest. And it eventually connects to the stomach and the abdomen. You have a muscle called the diaphragm, which is at the bottom of the chest, which is what helps us breathe. You can think about that as kind of the border between the chest and the abdomen. It also serves as the border of the esophagus and the stomach. So as the esophagus crosses the diaphragm, it becomes the stomach. The esophagus, really the only job of it is to push food down. There isn't really any digestion that happens in the esophagus itself. I want to focus first on the picture to your left. Okay, so you see this esophagus coming down, and then you see this area of narrowing here and fullness within the bottom of the esophagus here. This is actually a specific valve that we call the lower esophageal sphincter. This usually opens when you swallow and allows food to pass from the esophagus into the stomach. When you're not eating, this usually stays closed and prevents reflux from going back up into the esophagus. In acid reflux, as kind of shown in this picture, what we think is happening, at least partly, is that this lower esophageal sphincter, or this valve, is not closing all the way, or it's a little bit loose. And so what can happen is it makes you prone to have some of the contents that are in your stomach come back up into your esophagus. Your esophagus isn't built to deal with some of, things like the stomach acid. And so that's why you end up feeling pain or burning sensation. And that's kind of where we get that term heartburn from. Now, how is acid reflux affected by stress? Up to 64% of patients with a history of acid reflux report that their symptoms get worse during times of stress. How exactly does that happen? We think about three kind of main causes of this. So first, in talking about the lower esophageal sphincter, we see a change in the lower esophageal sphincter tone. And what we mean by that is exactly kind of what we talked about in patients who have acid reflux. We think that tone might actually decrease more. And so it makes you more prone to have reflux coming up. And so stress, for lack of a better term, kind of makes this area looser, is what we think. Coming back to stress affecting the gut motility, as we talked about on a previous slide, it can also slow movement of the stomach. So whenever food comes into the stomach digests it a little bit, and then we'll kind of push it along into our small intestine. Now, what can happen in periods of stress when it affects what we call gut motility, or the movement of the stomach, is that stomach can slow down. And so instead of moving things through, things stay a little bit longer in the stomach. And then that also kind of puts you at risk to develop some acid reflux. Lastly, and I highlighted this for a reason, is something called increase in esophageal chemosensitivity. Basically, what this means is even if you're having the same amount of reflux, your esophagus is much more sensitive to those changes, kind of the same hyper awareness that we talked about with the stress response. So a lot of times, and they've done studies on this, they see in times of stress, a lot of people may not actually have an increase in the amount of reflux that actually comes up. It's actually the same whether they're kind of in periods of stress or not. But what we think is happening is that you're just much more sensitive to that acid coming up. And so you probably just feel it a lot more. Switching gears to kind of a similar issue, we can talk about something called dyspepsia. Dyspepsia is less well known than acid reflux, but it's also very common. the main symptom of dyspepsia is pain or burning in the area of your stomach. This is kind of the center of your abdomen, right underneath your rib cage. If this picture kind of puts it into better perspective, it's kind of right in that kind of middle area of kind of your lower chest or upper abdomen. And so we think of kind of three main things with dyspepsia. One is that kind of pain or burning that we talked about. Another symptom is something called early satiety. And so early satiety basically is a way to describe, I guess it's a fancy term of saying you get full quickly when you eat. So what's happening here is kind of that same gut motility issues we're seeing with stress. The normal response of the stomach whenever you eat is to expand to accommodate all the food that you're eating. Well, what happens in periods of stress is that accommodation doesn't happen. So the stomach doesn't stretch out like it's supposed to. And so it kind of stays in that small caliber. And so whenever you eat, you just feel full that much quicker. And kind of in that same way, you feel full during or after a meal that's a little bit atypical. So there's several reasons why people kind of develop, and this is kind of what we talked about here, is that, so one, how people develop symptoms during times of stress, and one is that kind of impaired gastric accommodation where the food doesn't, or the stomach doesn't expand to accept the food that's being eaten. Another way that we think that stress worsens these issues of dyspepsia is increased sensitivity to the stomach acid. And this is very similar to what we saw in acid reflux, where your esophagus is just much more sensitive to that stomach acid. Now, part of this, we think in terms of this increased sensitivity, has to do with kind of the breakdown of the lining a little bit. We talked about the lining that's very heavily regulated. Well, whenever you have that lining breaking down in the setting of stress, you can get acid into places that theoretically are supposed to be acid free, and that can cause pain. And lastly, kind of the same concept of slowing how food empties from the stomach. When food just kind of stays around in the stomach, that can also cause a lot of these symptoms as well. And that comes back to that slowing of gut motility, and specifically slowing of the stomach in this case. Okay, I wanted to make a quick point just to say that, acid reflux, dyspepsia are both acid related issues of the stomach. And in that same spectrum, we do have something called peptic ulcer disease, which is basically stomach ulcers. Ulcers are basically a breakdown of the lining of your stomach, and it can cause fairly significant damage as well as tissue breakdown. Ulcers, kind of going back to this stress response, ulcers are found in higher rates in people who have high stress jobs. So these include, jobs such as air traffic controllers, or even if you live through traumatic life events such as war, you're more likely to have issues with peptic ulcer disease. So here's kind of an example picture that I can show you. So this is kind of normal lining of the stomach. You see here, it's kind of got a little bit of a pinkish color to it. And then here, right in the middle, is an ulcer. And so it's basically kind of a complete breakdown of the lining, and this tissue has just completely become damaged. Going back to this chart that we saw, this comes back to this permeability or this breakdown in lining. And so, when stomach acid can get into places that it's not supposed to, it can cause tissue damage and breakdown. In addition, when that breakdown does start to occur, it also causes disruptions in blood flow, which is kind of what takes, it's what we think may take, something like gastritis and kind of create an ulcer after that. And you'll see these kind of same issues that we're seeing here kind of present themselves over and over with a lot of these GI issues. Okay. The next kind of syndrome we'll talk about is irritable bowel syndrome, or IBS. This is a very, very common syndrome. It's one of the most common GI disorders in the world. Globally, it affects about 11% of people. So we're talking somewhere along the lines of around 900 million people. In the past, we used to commonly throw around the diagnosis of leaky gut, and that's usually what we typically call IBS. I thought the best way to describe it is to actually give you the criteria that we personally use to diagnose it. It is a fairly broad criteria, so a lot of people do fit this diagnosis. The first part of it is you do need recurrent abdominal pain for at least 1 day a week over a 3-month period. The pain that's typically related to IBS is kind of an abdominal cramping pain, but it can vary. Some people do have sharper pains. The pain is usually related to defecation or having a bowel movement, or it is associated with some change in stool frequency or consistency. And so usually you need 2 out of these 3 characteristics along with the abdominal pain to make a diagnosis of IBS. Lastly, there are 3 different subtypes of IBS. So there's a constipation type and a diarrhea type. This shows you the difference that different patients can kind of manifest similar type syndromes. So, patients can kind of vastly have different symptoms, whether it's diarrhea or constipation. There is this last subtype of patients that are mixed that have a combination of both of these. I wanted to kind of draw out a chart in terms of kind of how stress really affects IBS. So you start with stress here, and through kind of hormone signaling that we talked about, again, we have that, permeability, that kind of breakdown in the lining of your GI tract, or the leaky gut. And you also have that impaired motility, which is basically the kind of slowing down of the GI tract. And so both of these together can cause issues of visceral pain, inflammation, and constipation or diarrhea. The breakdown of the lining wall, this kind of leaky gut, is what we think causes a lot of this visceral pain and can also lead to a lot of the inflammation type symptoms that we can sometimes see. In terms of the constipation and diarrhea, this is where the kind of impaired GI or gut motility or movement kind of come into play. Constipation is fairly common. So when you do have a stress response, your GI tract, including your colon, slows down. Now, in some people, the response in the colon, for reasons that we don't necessarily understand, is actually sped up. So the colon actually goes faster than what it normally does. And that's when it causes the diarrhea part of it. When you have these kind of issues going on, that's when you can develop certain types of food sensitivities with that. This is kind of coming back to whenever you have these kind of breakdown in lining, some of these foods, you can think about spicy foods, alcohol, things like that, can cause irritation or pain whenever you eat them. And so that's where some of these food sensitivities and food intolerances can come from. You may also have some impaired digestion. Now, with IBS in general, impaired digestion rarely leads to any true nutritional deficiencies or weight loss. And then the last kind of part of this is because of your food sensitivities and intolerances, a lot of people end up restricting their diet to a certain degree. And then when you change your diet, you can actually alter the gut microbiome, which we'll kind of go into later. And that gut microbiome can actually signal more stress. So you almost get into this rabbit hole of stress where it's this feedback loop that just keeps going back and forth. And sometimes this ends up being really hard to break. The last kind of GI condition that I wanted to just touch base about is inflammatory bowel disease. So this is a different process than IBS. So inflammatory bowel disease is an umbrella term that includes both ulcerative colitis and Crohn's disease. These are in a category of diseases called autoimmune diseases. And basically what happens is there is an overactive immune system. Again, we're not exactly sure why it happens, but one of the theories of that is the breakdown in that lining of the GI tract that can cause inflammation when certain substances can get to places they're not supposed to. And so basically this overactive immune system can cause inflammation in your body's own tissues. And in the case of IBD, this is within the GI tract itself. Major life events or stressors are not only thought to be an exacerbator or something that makes IBD, inflammatory bowel disease, worse, but are actually thought to be potential causes of inflammatory bowel disease. There's actually a couple interesting studies that happen with this. So they studied the specific species of monkey in Colombia, and it's this type of monkey has a very specific family unit consisting of I think 3 females and 2 to 3 males. Well, what happened is when they started keeping these monkeys in captivity, they would keep them with 1 female and 1 male. And that actually was enough to cause a lot of these monkeys to develop ulcerative colitis when it was a very rare diagnosis out in the wild. Same thing in humans. There was a nomadic tribe in the Middle East. And as the weather got hotter, there was droughts, and then there was also issues with land reclamation. They couldn't keep up with their nomadic lifestyle. And so they started moving into government housing and things like that. And just the process of kind of moving into that government housing was enough to cause a lot of them to have to develop inflammatory bowel disease. I know we touched on this a couple times throughout the talk, but I wanted to kind of take the time to discuss this for a few minutes, and that's the gut microbiome. And so what is the gut microbiome? This refers to the collection of colonized organisms inside the GI tract. So it includes all the bacteria, fungi, and viruses that are within the intestines of your GI tract. In humans, it's estimated that we have thousands of different species with over 30 trillion individual microbial cells. To put that in perspective, a total human body, the total number of cells in the human body is around 30 trillion. So we're almost doubling that just in the GI tract. So there is a careful balance that's in play here. The body wants to be tolerant of these organisms because there are a lot of important things that a lot of these organisms do, but we also have to kind of protect ourselves if there is a bacteria that does in fact, or that does kind of come out of that balance. And this gut microbiome is thought to actually play a crucial role in signaling back to the brain different things. And so, there's a lot of different there's a lot of different conditions that we're actually studying as associated with the gut microbiome. And we've already kind of briefly talked about irritable bowel syndrome and inflammatory bowel disease, but things like diabetes, they've actually found that, when you develop type 1 diabetes, your gut microbiome is lower than normal. Or if you're type 2 diabetic, then there are certain, if your gut microbiome is close to normal, you actually have a better chance of maintaining your diabetes in good control than if you didn't. Cardiovascular disease, there's some signal there, but we're still really early in that. Mental health actually is a big area as well. So the gut microbiome has been shown to release certain substances and hormones such as serotonin and dopamine. And these are important hormones in terms of regulating anxiety, depression. And so when these are altered with the gut microbiome, sometimes it can actually worsen or sometimes preempt anxiety or depression. Now, again, these studies are very early on, so we still have a lot to learn. And then the last is actually with obesity and weight gain. So not only do some of these bacteria kind of signal you when you're full and kind of maintain that fullness factor, but there's also, in periods of stress, you actually decrease a hormone called dopamine, which is kind of a pleasure type hormone. And so we usually seek it out. And so what can happen is when stress decreases the dopamine, we actually overeat to try and compensate, because overeating actually kind of prompts a dopamine release. And so we try to make up for it. And so that's where we think some of these kind of overeating type tendencies may actually come from too. I wanted to talk about different factors that could improve the gut microbiome and certain factors that can worsen that gut microbiome. So fiber is kind of the mainstay. Everything we know, increasing fiber does improve gut health a significant amount. The other thing is eating fermented type foods. So these include yogurt, kimchi, sauerkraut. So these types of fermented foods contain what we call probiotics, which you've probably heard of, which are basically active cultures of good bacteria that we need within the gut itself. And then we also have something called prebiotic foods, which include things like garlic, onion, wheat, oats. And prebiotics are a little bit different from probiotics in that prebiotics are not active cultures, but you can almost think of them as food for the good bacteria in your gut. So it just promotes those good bacteria to kind of form and thrive. So things that seem to worsen gut health. So sugar and artificial sweeteners are definitely high on that list. That's probably one of the worst, if not the worst, along with the highly processed foods. So even if you made a homemade pizza versus buying a kind of store-bought, frozen pizza, just the fact that the homemade pizza, even if it has the same number of calories, the same fat content, but the fact that if it's without some of these highly processed ingredients, it's actually going to be much healthier for you, and much better in terms of your gut health as well. And then the last two are things like fried foods as well as red meats also tend to worsen your gut health. So I wanted to kind of show this picture. I know we've kind of been talking about, each of these conditions individually and how it affects stress, and also each of these different kind of aspects of how stress affects different parts of the GI tract. We talked about them individually, but the reality is it's all kind of part of one system. And so there's not really a scenario where you can really just individually look at one thing. It's usually connected to a lot of these other things. That's all I really wanted you guys to get away from this slide, is that it's not usually as simple as just one specific thing and then you can just fix that one thing. There's usually a lot of other kind of issues going on, and one symptom that seems to be predominant. So with all that said, we've talked about kind of the negative kind of consequences of stress on the GI tract. So what do we do now? So one of the kind of more common things that we do in clinic, especially in GI clinic, is we start with medication therapy. So depending on what we're treating, we can use different types of medications. So for acid reflux and dyspepsia, we use acid reducing medications to try and reduce that kind of irritation as much as possible. For irritable bowel syndrome, we treat the constipation or diarrhea accordingly. We can also treat that visceral or kind of spasm type pain that people can get with IBS with kind of these muscle relaxer type medications. These include medications like Bentyl and hyoscyamine, if any of you guys have taken these. There are certain promotility agents as well. And what I mean by that is these are medications that help kind of propel the GI tract. So again, we talked about the stress response kind of slowing down the GI tract. Well, these agents we start these agents with the hope that they kind of promote movement. And so they prevent some of that slowdown. Last, with inflammatory bowel disease, there's several medications available for treatment. I didn't want to get into all of those here. That can be a talk in and of itself, but just know that there are several medications. Inflammatory bowel disease is one of those that, with acid reflux and IBS, you don't necessarily need to treat it if your symptoms are mild. With inflammatory bowel disease, there are certain consequences like increased risk of colon cancer if you leave it untreated. So this is a situation where you would treat either way. The next kind of, coming back to the article that we talked about at the beginning, one of the things they talked about is ways to de-stress, right? So the problem with these kind of medication type therapies is that it is, in a sense, especially if stress is one of those things that's kind of exacerbating all of this, then it is, in a sense, putting a Band-Aid on some of the consequences of stress without actually treating the stress itself. So these are kind of ways, that this particular article had recommended in terms of de-stressing. So the one thing I would like to say is that every individual is different. So, what seems to work for you in terms of de-stressing may not work for other people. And so sometimes this is something you may need to try a few different techniques, and then you'll find ones that work for you and ones that don't. So breathing techniques are very common. And one of the ones that they mentioned in the article is square breathing or box breathing. And this is a type of breathing exercise that's fairly common, I think, in the military. And so basically you think of 4 seconds. So you take a 4-second breath in, exhale for 4 seconds, and you do it 4 times. And these types of breathing techniques are thought to activate the parasympathetic nervous system, as opposed to which is the kind of rest and digest, versus the sympathetic nervous system that's already activated, which is the fight or flight. So it's basically trying to reduce that fight or flight response. Physical activity actually has some of the best data in terms of reversal of stress-related effects on the body. So if you can do 30 minutes of at least moderate intensity exercise, that's been shown to be a huge benefit. Things like yoga, Tai Chi are also very beneficial. I think part of this is, some of the physical activity, but with yoga and Tai Chi, they're also very much focus on things like breathing, which we kind of already talked about as a potential benefit. And acupuncture also actually has a lot of data in terms of benefit for stress relief. Now, these are some of the techniques that you can kind of do at home and by yourself, but sometimes you may need kind of further therapies that are a little bit more intensive. And this is where kind of cognitive behavioral therapies come in. And basically, these types of therapies teach you how to control your perception of stress and kind of change your view on certain situations. And so, for example, if there's certain situations that cause stress for you, they kind of teach you how to think about the situation differently to where you may not be as stressed out. Dynamic psychotherapy is a type of therapy that focuses more on interpersonal relationships. And that's actually been shown to help quite a bit as well. Lastly is any sort of relaxation therapy. This is usually done in combination with cognitive behavioral therapy. And it's basically a way to teach you to deal with acute stressful situations. So, and the last thing that's kind of been mentioned everywhere is you have to embrace support. So, I think the inclination for a lot of people is to try and kind of deal with these issues on your own, but make sure that, especially when people lend support or you need to ask for support, that you ask for it, and take some of that load off of yourself. And I think that by itself, I think will help a tremendous amount of people if you kind of go that route. So to kind of close things off, we've kind of talked about stress, and we've kind of mentioned in multiple ways how it can affect the GI tract, and how it can exacerbate several common GI conditions. I wanted to put this in here. These are real organic processes in response to stress. Some of the, certain, especially in clinic, sometimes it is hard to bring up stress as a potential, if not a cause, definitely something that's making, certain symptoms worse. I think sometimes, we're not very good at, kind of making it clear that these are real kind of organic processes going on. And I think sometimes patients may feel that, when we kind of blame it on stress, we're not, taking their symptoms as seriously, but I don't think that's always the case. It is a very real thing that can cause symptoms. It's important to monitor how stress may affect different GI symptoms you may encounter. Like I said, this is going to be different person to person. And so each person is going to manifest this a little bit differently. And then if you do end up coming to clinic, whether it's to a GI doctor or any other physician, be open about discussing the role of stress, and how it may affect some of the symptoms that you're having. Well, I understand that I cannot ask you to stop being stressed, and I understand that it cannot be fully avoided. Incorporating techniques to reduce stress, especially in those kind of acute stressful situations, will definitely help in the long term. And so with all that said, our goal is to kind of take that, brain gut relationship and make it a happy marriage, so to speak. So thank you guys. I appreciate the time, and I'm happy to take any questions that you might have.
So if you have any questions, you can take yourself off of mute and you can ask the questions. You can also submit your question via chat.